Hello, I'm Dr. George Livermore with the Ear, Nose, and Throat Institute. I just wanted to take a minute and discuss, as sort of an infomercial, the difference between allergies and coronavirus. And the reason is really, in our specialty, we're seeing patients with many overlapping symptoms. The runny nose, the cough, and fever, right? Fever is sort of a hallmark thing. You see them out screening people for coronavirus and they're taking a temperature, and that's one of the big things they look at to differentiate just a cold versus coronavirus. So one thing to think about is the coronavirus is created by a virus, and a virus is an extremely small particle. It being a very small particle, can you come over here? The coronavirus will oftentimes bypass the normal filter mechanisms in the nose and go right down into the lung tissue. When it does that, it's getting access to just a huge surface area because the lungs are made up of a multitude of small pockets, and if you spread all those out into just a big sheet, you have a huge surface area, and then the viral particles actually attack the membrane cells, and some of those cells will die or get altered such that your body will create an inflammatory response, a response to infection or something invading it. And that causes a lot of swelling, superficial swelling in the lung tissue. That causes a systemic response, which is manifested by fever. That's why fever is one of the hallmarks of coronavirus infection versus allergy, your common cold. Because both allergy and common cold will tend to stop here in the sinonasal area, and specifically allergy, which is what we worry about here in Georgia in the spring season, especially since we didn't have much of a winter. Allergy doesn't attack the cells. It doesn't create that attack mechanism that forces the body to react. It does stimulate the allergy system, sends out histamine. Histamine goes on to create increased blood flow to the nose and sinonasal passages, which creates the congestion. But you don't get that fever early on the way you do with the viral infection. So that's why one of the hallmarks between common cold allergy, coronavirus, is that fever, that early stage fever, the early stage cough, because the lining of the lungs are getting affected very early, whereas with just sinus or allergy or cold, the infection part comes later. There's just the swelling from the allergy response through histamine, and then as the normal passages that drain the sinuses get blocked off, you get a secondary infection. That's why lots of times people will say, well, a cold that lasts longer than 2 or 3 weeks is a sinus infection. And there's a lot of truth to that old adage, because it takes the 2 to 3 weeks for the mucus in the sinuses to get stagnant. The mucus has salts and sugars and everything that bacteria like, and you get a secondary infection. So the fever in cold, allergy, resultant sinus is much later than you see in coronavirus. Cough is the early thing with coronavirus. And that's the big difference that we see. We oftentimes screen outside for fever, and some of our patients get upset because we turn them away, but we're just trying to be safe. So just in summary, one of the big differentiating factors between coronavirus and allergy or the common cold is the early onset of fever, the early onset of shortness of breath. And the shortness of breath occurs because all of that lining of the lungs gets that immediate swelling, or it's called edema, or fluid between the alveolar or the lung surface and where it picks up to transport the blood and pick up the oxygen. So you get a resistance to oxygen flow through the lungs, and that's why you end up with the shortness of breath with coronavirus. I hope this is helpful for you. We're here for you. We're trying our best to deliver care, good care, to our patients through this strange time we're living through. Please call us if you have any questions or problems. We are available both in our offices and via telemedicine. Thank you.